LINNC Paris 2022, and I have the honor of having with me today Professor Giuseppe Lanzino from the Mayo Clinic. And you were talking during the meeting about subtle signs of thromboembolic complications. Do you want to tell us a little about that?
Yes, basically the main complications we can have during endovascular intracranial procedures are either embolic, thromboembolic, or hemorrhagic from rupture or perforations. The thromboembolic complications, I've noticed, they tend to occur in the immediate peri-procedural period. And therefore, if promptly recognized, they can be corrected with the pharmacological interventions. And over the years, we have been able to pretty much almost prevent or correct promptly any thromboembolic complications that we have encountered during treatment of ruptured and unruptured aneurysms. And the key really has been to have a very low threshold to suspect potential complications. And in the case that I described, there was a fairly typical case where because of a sequence of events, we could predict based on past experiences that that patient in question was at high risk of developing over time, usually in the first few minutes after the procedure, a clot at the level of the anus that was treated. And therefore, what we have implemented in the past few years in our unit is a protocol where especially when we see or when there are particular circumstances where we could anticipate a higher incidence of potential thromboembolic complications, instead of finishing the procedure immediately after the completion, we wait. Often we reverse the intraoperative pharmacological anticoagulation, and then we do serial follow-up studies over the next, usually we wait between 10 and 20 minutes. And it's during that period of time that we have been able to recognize subtle signs that alerted us to the formation of a thrombus, of a clot, and with pharmacological interventions we have been able to successfully reverse pretty much all of those situations with good clinical outcome.
Do you have specific signs or?
Yes, there are subtle, as I said, the serial follow-up images after several minutes after the completion, often after reversing the anticoagulation. Often in those situations you can see subtle signs of slowing flow or very small initial clot formation, usually around the contour of a device or a coil at the interface with the parent artery. And based on those early signs, we have devised adequate interventions that allow us to correct most of those complications.
Well, thank you very much.
Oh.